Good morning. This is Dr. Brad at Your Health Reclaimed, where we are always in an evolution of what we're really getting into and what we're going to discuss. We really are looking at dealing with root issues, which are the lifestyle things that end up creating poor health. We have a choice in how we live, and most people may not view it this way, but we choose whether we're going to build good health or poor by the way that we live. And that's the real root cause of almost anything that's out there. So today we have another interesting guest. This is Dr. Deb Muth. She's up in Wisconsin, which is a cold country.
Mm-hmm.
It's funny, the next door to the 10,000 lake state, and Wisconsin has more than 10,000. Go figure that one out. It's really, really funny. But the state bird in both of those states is a mosquito. Most people don't realize that mosquitoes are insane up there.
Mm-hmm.
Absolutely insane. And it's a running joke in both the states, but it's well deserved.
Mm-hmm.
So welcome to the show, Dr. Deb. Why don't you introduce yourself?
Thank you. I'm so happy to be here. So, I am Dr. Deb. I'm a nurse practitioner and a naturopath by conventional training. I own an integrative clinic here in Wisconsin called Serenity Healthcare Center, where we treat root cause illness. I am in the process of launching my second book called Seen at Last, where we talk about root causes and what it does to um, create neurological disease and all the different underlying things that actually create the neurological disease, and how oftentimes people are misdiagnosed because they're just labeled with a cause, and that may not be the actual cause. And once we go digging for that root cause, we actually find the true answer. And when we find the true answer, we can actually heal the problem 80% of the time, I would say. So it's an exciting time for us to be in practice because we get to change a lot of lives, and that's what we're here for. That's what we do.
So, Seen at Last, that title, it
Yeah.
to me that seems like one of those dual meaning titles. Is that one of the under not so bold a statement of women issues are typically pushed off and shelved and that women are finally seen at last? Or is it more about the discovery of these neurological issues?
That is a great play into and very, very knowledgeable on your part. So it is more about the women that are seen at last, the women that have been dismissed in our healthcare system, all the times that they've been told that it's all in their head or they're crazy or, it's just your hormones or it's raising children and you just need more rest, and ultimately been dismissed by our healthcare system. And once they understand that their symptoms are not that and they actually do mean something, we can find that underlying cause and actually help them reverse it and get their lives back the way they want to live their life.
Something interesting I'll add about the North Midwest up there. It's highly populated by Scandinavians
Yes.
who are extremely stoic,
Yes.
just flat emotionally, which women were not designed that way.
No, they're not.
So, so it's a place where women are not going to be heard much. I spent a lot of time up there in Midwest, and a pastor friend of mine is an older gent. I'm not sure if he's still alive, probably not. Anyway, he knew that I'd spent some time doing ministry over in Eastern Europe and Russia and all that. And he was talking to me one time and he asked, "So do they experience joy over there,
Oh,
Eastern Europe and Russia?"
oh,
And I looked at him, he's one of those stoic Scandinavian, I think he was a Swede. And yeah, and I'm not saying that in a derogatory
right.
sense, but he's a pastor of a Lutheran congregation, primarily Scandinavian
Hmm.
people who are just completely stoic. And I thought about, and the Lord gives me this way to answer. I said, well, you take the idea of joy, how it's expressed in your congregation, stoic, Scandinavian people.
Hmm.
You take that expression, you move that down the road. There's a Assembly of God down there. They're going to express that a whole bunch different. You
Hmm.
get down into a Southern Pentecostal place, it's going to be totally different. You get in a black Southern Pentecostal,
Hmm.
and you're going to have just a ton of emotion. The expression of emotion is completely cultural.
Hmm.
They've been repressed for 75 years. Do they have it? Yes. Do they express it in the way that you do culturally? No.
Yep. Hmm.
So you get into those northern places like Wisconsin with this stoic Scandinavian attitudes about things. Women can feel really forgotten and repressed. Men tend to be not quite as bad as a caveman, but just so flat,
Hmm.
so non-responsive that a woman doesn't have someone to share the emotional experiences of her life with.
Yeah. That is
Uh,
very true. Yeah. And I am one of those. I'm a Norwegian. And so I was raised the same way. Like you just suck it up, honey. It's just the way it is. You just move forward. And I watched my mom, who is of Polish descent, very, very stoic. Like she doesn't complain ever about anything. She's 86 years old. And you ask her how she's doing, she's like, I'm fine. I got nothing. This is a woman that never goes to the doctor, never complains about anything. She's just, you're just built to be strong. And that's how we were raised. You don't complain, you don't whine, you put your head down, you do your thing. Nobody wants to listen to you whine anyway. Just move forward. And it makes it very challenging as a woman when you have symptoms and you're like, okay, what do I do with what I have? Who do I tell? Who do I trust? Because you've been raised up to believe that you don't complain about anything.
None of that, but you're going to. I ran into this a little while ago, and I think this is well stated. Women going to a doctor is a very vulnerable position.
Yes.
You have this hierarchy of issues where most people with a doctor title have these really fragile, inflated egos.
Hmm.
They're very condescending.
Yes.
Um, so women have these sensitive issues that they need to discuss, address, and talk about with this condescending pressure of this hierarchy of superiority of someone who doesn't experience that.
Hmm.
Especially if they're male. And it's really a violation of femininity that should be protected, and women, the people around them, should understand. And then the more empathetic a person is, the more reality this is, where you really build a sanctuary around them, where they're protected and they're safe, they're secure, and they can connect with whoever they need to discuss these sensitive issues. That doesn't exist in these Stoic societies.
It does not. It does not. Because you would expect, like, to be able to go to your mom or your sister for this. But if they were raised the same way you were, you're not getting any empathy from them. Not at all. And, it's interesting because I have a lot of female patients who come to me and will say some of their worst doctors were women. Like they were mistreated by women just as much, if not worse, than they were by a male.
I'm not surprised. That reminded me of this. The dean of student affairs in the high school I went with was
Hmm.
an ex-Army wax sergeant
Oh boy.
who people said she was as big around as she was tall. And that's an exaggeration, but she
Uh-huh.
waddled, she didn't walk. One day, I hated school. I
Uh-huh.
absolutely hated school. If I didn't get out early, I probably never would have graduated. High school anyway. And one day she tags me in the hall. Never interacted with her before,
Hmm.
never interacted again. Follow me, snakes through all these halls, and we come in this small room. She's got this table that I don't even think it was 3 feet around. Drags me in there, closes the door. She's got a desk against the wall and almost no room to get between the table and the desk. And there's this pile of notes in the center of the table. She's
Mhm.
trying to get me to confess of cutting school. Which I cut a lot of school.
Yeah.
I don't know anybody personally that cut more school than me. I cut a lot.
Yeah.
And she's trying to get me to confess, and I'm not going to do that. And she says, well, if you don't confess, I'm going to call your mom. I don't care, go ahead.
Mm-hmm.
So she pulls out the note off the top. This is juicy note for like a week's absence. So she calls my mom up, and the lady goes, hi, this is Dee Silva from Del Valle High School. I just perchance have your son, Brad, in the office here. Can you tell me if he was sick on these certain days? So my mom is like, she's reading the note. Oh, yeah, he had strep throat, and he had all these things. And this lady's jaw is just going farther and farther and farther and farther down. And she's just confused.
Mm-hmm.
And it was just so blatantly obvious on cutting school. She just happened to pull out a note that was good. It
Yeah.
was real. I just played a game. I never had my parents write notes or
Mm-hmm.
and I didn't even try and hide my handwriting. It's just a game. My last year of high school, I actually registered as two different people. I made a fictitious character. I went around, I got a complete schedule of this fictitious character,
Mm-hmm.
and I show up the next year at school going, who do I want to be? And I realized the joke would be on me, because if I went as a fictitious person, then I could never graduate and I'd be stuck there longer than I want. But, I played the game quite a bit. That is what you're talking about, somebody with that kind of attitude. And when my mom, she's chatty,
Mm-hmm.
and it's like, oh, I get to talk to somebody. And she's
Yeah.
just chatting on and on and on. And this lady, her jaw's getting lower, and she's okay. Hangs the phone up, and she's just looking like this.
So defeated.
And after about a minute, I look at, is that all? No answer. She just looked at him, and she knows I've got school, but how do you do that?
Yeah.
How do you do that? And I said, can I go now? No answer. And I finally got up out of the chair and I said, bye. And I never saw her again. She never called me in the office.
Wow.
Just totally blown away. But that's what you're talking about
Yeah.
clinically, that kind of attitude.
Exactly. I had a similar story I was thinking about when you were telling this. I too was not a great student, so there must be something about us in healthcare. And I remember my senior year, my principal catching me on the stairs and saying, I'm waiting for your dropout papers on my desk along with all your other friends, all expected in the next week. And I just looked at him and I'm like, I wouldn't give you the pleasure of day to get my dropout papers. I said, I'm going to prove you wrong about who I am. And, that's just kind of who I am. I'm a rebel child. And graduation came and went, and there we were. And he couldn't believe it. And I remember seeing him at one of my reunions, my class reunions. And I walked up to him and I said, hi, do you remember me? And he's like, yes. And I said, well, good. Then you can call me Dr. Deb from now on. And he didn't know what to say. He was so blown away. He thought I was
Wow.
the biggest piece of crap that could ever leave the school.
Wow.
Yeah, it's
Yeah.
really sad what how we treat people and what we think of them.
Yeah, it's interesting. I had a few teachers who saw something different. I'm one of those people that have drawn these very, very tough teachers to,
Hmm.
who challenge me to go higher and higher and higher. And I have the utmost respect for those people. I really do. That's just been my life's journey. My graduation was, that's a wild story. I won't go there, but it was absolutely, completely wild what went on there. And it's amazing that we can survive
Yeah.
in these. Where I went to school, it was not educational, it was indoctrinational.
Hmm.
And they would just want to cram their garbage down. Idea of these universal childs, where
Hmm.
if you could take any child of any sex, put them in the same environment, they're going to be the same personality and interaction, all that. And being the last of the children in my household, I didn't have anybody to weigh that against.
Hmm.
But when you become a parent, you go, you got to be insane to have a view like that.
Yeah.
You have however many children you have in the same environment have radically different personalities.
Gotcha.
And it's like, wow, I found out the purpose of high school where we were at was to keep teenagers out of the workforce.
Really?
Yeah.
Wow.
So they didn't compete
Yeah.
with older people.
Wow.
And that was just the last straw for me.
Yeah.
Just the last straw. But it's interesting that we take these backgrounds and use those as character development.
Hmm.
And then we go and we become people that no one would ever have believed or expected.
Yeah, very much so. No one in my class would have ever expected me to be doing what I'm doing. And there's a bunch of people in my graduating class that I look at now today and I'm like, gosh, I would have never seen that in that person. But yeah, sometimes when you get away from what is expected of you or what you think is expected of you, you can become who you are meant to be.
Yeah, and with you being nurse practitioner and naturopath, I assume naturopath was first. Am
It
I
was actually,
right? Really?
yeah.
Wow.
Yeah, it was second. So I became a nurse practitioner first, and I loved women's health. That's my love of life. Worked in a fertility clinic and just really enjoyed it. And when I was 28, I got sick myself. And I knew enough that when I saw the doctor, I was coming out with one of two diagnoses. They were either going to label me with fibromyalgia or MS. And I came out with a fibro diagnosis, and the doctor said to me, here's a prescription for narcotics. Here's a prescription for antidepressants. Go home, get ready, and expect to be disabled in 4 years. So I kind of had that whole scenario from my principal all over again. And I was like, what? And after I cried my heart out and thought my whole life as I knew it was over, my husband said to me, Deb, you know somebody that can help you. And so I had my wacky witchcrafty friends back in the day that did all this woo-woo stuff. And I called them and said, okay, I'm at wit's end. You guys know somebody. And they were like, absolutely, come with us. Let me teach you. And so they taught me about nutrition and lifestyle and supplements. And 3 weeks later, all of my symptoms were gone. And I happened to have been working in a clinic that had a lot of Hispanic immigrants in the clinic, and it was a women's health clinic. And I started noticing they were doing all these herbal things along the same time I was learning about herbs. And it became very fascinating to me. Like, they went through pregnancy without any problems at all. They went through labor and delivery without any complications, no medications, nothing. And I started to become more and more curious about what they were doing, and then more and more curious about my friends and what they were doing. And as I realized there was this whole other side of medicine that I didn't learn as a nurse practitioner. And so that's what made me decide to become a naturopath at that point. Like, I needed that part of things that was missing.
Interesting. My wife pulled up a couple of podcasts recently. One was Dr. Mark Hyman, and the other person was Susan Saul, both very, very well-known integrative
Mm-hmm.
docs. And it was stated in those talks that something that a lot of people don't realize, I did some study on this and I can really get into the history, but they don't teach lifestyle
No.
in any doctor school. They don't teach it in allopathic medical school.
Mm-hmm.
They don't teach it in chiropractic school. They don't teach it in naturopathic school, and they don't teach it in homeopathic school. I was blown away. I got asked to do a talk on education in a summit. And so I dug into the education. What blew me away
Mm-hmm.
is you don't have the clinical classes in homeopathy and naturopathic schools of gastroenterology, cardiology,
Right.
genital urinary issues. You don't have any of that. I was shocked,
Mm-hmm.
absolutely shocked. You don't even have pathology
Nope.
in those schools. You have these ideas, but not a foundation to really process the information. I've talked about what I call a YouTube PhD for a long time. You got this access to a ton of information, but you don't have the foundational roots to be able to really process and understand it. With your background in nurse practitioner, which is, it's just a hair underneath what a medical doctor is, and you got to work underneath one to a point, but it gives you a little bit more liberty and all that. That would at least allow you to process these different concepts in a way where you can integrate those collectively if you change your philosophy.
Yeah, exactly. It's very hard. Without the medical background, I think it's a challenge learning the naturopathic piece, because you understand lifestyle and you understand nutrition, but how it plays in to the organ systems or to some of these diseases is where it leaves you kind of empty. But in the naturopathic world, we don't really care about disease. We just care about the body as a whole and getting the body to function properly. So there's just a little different philosophy there.
Right, which that's something else that three things in those podcasts that I thought was really amazing. Most people don't realize that diagnosis is only an insurance code. It does not, it gives no indication of causation, and with no causation, there's no concept of resolution. And resolution of a disease process is not even a subject matter in the schools. The other thing that they said was that the treatment of disease is using pharmaceuticals to disrupt some biochemical pathway. Do you agree with that? And when you get into more the naturopathic side, the lifestyle issue is you're working outside of diagnostics. Of a diagnosis, not diagnostics, but of a diagnosis. You're not looking for a name on things. You're looking at the root issues that build the whole process of poor health, and helping people, coaching people, caressing people into making the right choices to build proper health. And these so-called names just tend to disappear like what yours did.
Yeah, they definitely do. I mean, on the naturopathic side, we're looking for those patterns of things. And like you said, the root cause, like what's causing your body to be out of balance? Because whatever is causing the body to be out of balance, we want to eliminate so the body can become in balance again. And if the body's in balance, then it's free of dis-ease, not disease, but dis-ease. And so those are the kinds of things that we're looking for all the time in putting those pieces of the puzzle together, whether it's a toxin or a chemical imbalance, a metabolic imbalance, a food intolerance, whatever that is, what's causing the imbalance in the first place.
Hi, this is Dr. Brad. I'm going to cut in here. This is an extremely personal, raw, dynamic conversation. It took me a lot of tweaking just to get Dr. Deb's voice to even work on here. And so I finally got that, and we're going to cut this one short. Right here, we're going to cut this one into 3 different sections because this is a very, very good, deeply raw, personal conversation where we talk about things that really aren't talked about a lot, especially male to female or female to male, because the conversation is very back and forth. And I don't want to be condescending in my approach to this, but we are dialoguing about things that virtually are never talked about in healthcare. And this is extremely, extremely important. So I don't want to push the envelope on the time very much. So we're going to cut this one into 3 sections, and it stays really good the whole way through. So we're going to cut this one short. Tune in to the next episode. We release these every Monday and Thursday for the continuation of this conversation.